This is Steve Zeltzer with WorkWeek Radio, and we're talking with Darrell Whitman, who is a former investigator and lawyer for OSHA, federal OSHA, now living in Moldova. And he is going to talk to us about what the country has done to protect the workers in the face of this worldwide epidemic. Welcome to WorkWeek, Darrell.
Happy to be with you, Steve. Happy to talk about my little country here, Moldova. Yeah, just to let people know, Moldova is a country of about 3.5, 4 million people. It's between Romania and Ukraine. It has a long history. It was part of the Soviet Union, and it experienced the collapse of the Soviet Union 30 years ago. Very traumatic for all of the people in Central Europe. But one of the silver linings of that kind of a crisis is people learned what was important, how to organize themselves and solve problems. So when the coronavirus first appeared, on everybody's radar, it was in China, and China is the other side of the world. But here in Moldova, because there's a lot of associations with other countries, it's very export dependent. There was a sense of identity with what was happening with this disease. They immediately started planning. The first case of coronavirus appeared in this little country about 3 weeks ago. I learned about it because I was walking home one afternoon and was greeted by a group of people that were handing out masks, surgical gloves, hand sanitizer, and information about the virus and how to protect yourself and some of the basic steps that everyone now recognizes to try to reduce the effect. A few days later, the government announced that they were closing the schools. The last day, my language tutor has a 4-year-old daughter in preschool, and she came home that last day, and she was very excited. She wanted to tell her mother that they'd spent the whole day talking about the virus in her preschool. And they had gone through the health issues. They had gone through the how to protect yourself. And she was excited because she wanted to share it with her mother and her family so that they could protect themselves. So they marshaled, in effect, the social capital of Moldova to begin the process of finding a way to reduce the impact of the virus. In the 3 weeks that followed, which leads up to today, after they closed the schools, almost all of the businesses closed voluntarily in Moldova. They simply asked everyone that could work from home to work from home. They made sure that there were pharmacies that were open and that there were grocery stores open, and even the banks. Some of the banks are open on limited service because those are essential to everyone's life in modern times. So it was very eerie. The first week and a half or so of doing that, I walked around town a little bit. It was very quiet. It was the first time in 4 years I could hear the birds. So the irony was, it was very peaceful. There was no panic. People were concerned, and you could see that. And the people I do know and talk to recognize that it was a very serious health crisis, and that people needed to pull together and help each other. The government basically immediately moved. The health ministry basically moved immediately to set up lines, telephone contact and email and computer contacts for people who thought that they might be sick, and gave them access to healthcare professionals that could advise them about their symptoms, counsel them about how to deal with it, encourage them to do the basic things, wash your hands, eat healthy, sleep well, reduce your levels of stress, etc. And if they needed, if the symptoms were serious enough, they could arrange to have someone come in a car, pick them up from wherever they were, and go to the hospital. They were doing that in part because they reduced the time when the public transportation system worked. And I was very interested to see when I walked downtown, there were only 3 or 4 people on each one of these trolleys, but the drivers all had masks. They had the gloves. If I'd wanted to get on, they had hand sanitizer at the door so you could clean your hands. And there was actually a policeman on every one of the trams to make sure that people took care of themselves. And also, if they needed, they thought there was any good reason, they would take their temperature, and counsel them about going home and staying home. Don't wander around the city. So it was very reassuring to see that. It gave me a great sense of confidence, and I've told many people I feel fortunate to be in this little country, because even though it is poor financially, it's not a materially rich country at all, and people work hard. They work together well. That's a very big key. They have very strong families. So my language tutor told me on yesterday, she said they're using it as an opportunity for spending time together with their family, cooking together, cleaning together, reading stories, listening to music, and
Are you there? Hello? Hello?
Hello, can you hear me?
Yeah, I can hear you. Good.
Okay. So there's been a real strong response, social response, the government providing leadership. The airport is closed, has been closed for over a week now. The borders are closed. You cannot get in or out of Moldova at this point. But the number of cases this last week, which would have been about the 3rd week of the crisis here, the number of new cases leveled off. I mean, we have all of about 50 cases in the entire country, which is good, and they're growing very slowly. The number of cases is growing slowly, which is, I think, a reflection of getting on top of it fairly quickly. There's only been 1 death, and I understand that was someone who was already in poor medical condition. The health minister comes and talks for 15 or 20 minutes, gives a report every day, every morning. And she's very comforting. It reminds me of people talking about Franklin Roosevelt and his fireside chats. She's very informal in a lot of ways. She began when she first began talking about what we needed to do, and she started by saying, "This is a time that tests our values." So it began with the idea that there's a community here, that there's people here, that they have values, and appealing to that sense of community and family values and personal values, that rise above material things. So at this point, I feel very safe. I'm certainly in one of the high-risk groups, I suppose. I have pre-existing medical conditions, but I'm fairly confident that I will survive this, and overwhelmingly, most of the people of Moldova will survive. if we've only had one death and we only have 60 cases after 3 weeks, and they're not growing exponentially as they have in places like Spain and Italy, then I think there's reason to be optimistic about it. But we continue to be very aware, and people, will ask you if you're out, and I do like to walk. There's hardly anybody out, but sometimes when I'm out now, someone will ask me, where I'm going, or how I am. I mean, there's really a definite sense of concern about everyone in the city. So I feel badly for my friends and my family in the United States and in Britain and in Italy and France and Germany and Spain, because they're really struggling somehow. All these modern countries with all these advanced medical systems and wealth of these countries, they seem to be really struggling with how to address what is a community crisis.
And we're talking again with Darrell Whitman, former investigator, lawyer for OSHA in the United States, whose job was to protect health and safety whistleblowers. And Darrell, in the United States, public services have been attacked, privatized, destroyed. There's a shortage of nurses here in San Francisco at San Francisco General Hospital. They've outsourced it to nonprofits. It's a dog-eat-dog world in the United States with all the wealth that we have here. So the collapse of the Soviet Union, what effect did that have on Moldova, other countries in Eastern Europe, as far as how they could survive in a situation in which the entire society collapsed? Because that is what we were facing in the United States, with a complete crash of the stock market, banks possibly going bankrupt, pumping a lot of money in. But if there's no economic, if people can't buy things, or if there's no financial system that is going to withstand that, what do people do? And what were the lessons from the collapse of the Soviet Union for people in the United States?
Well, one of the things is it's not it's not the disease you have to be concerned about. I think that there's plenty of medical expertise and facilities and equipment to protect the vast majority of Americans, but it's the disintegration of the social, economic, and political structures that, as of what happened in the Soviet Union, that devastated many of these countries. It was devastating in Russia because you had the life expectancy go from about 72, 73 years to in the upper 50s in 2 years. It was unprecedented for any advanced society to have that kind of a crisis that literally was killing millions of people. For Moldova, every country is different. I think that's it's important to keep in mind. There isn't a one-size-fits-all resolution to anything. There's not a magic bullet. What really happened here that made it possible for Moldova to survive, they have very strong family values. They have very strong community values. We still have in Moldova, we still have communes. We have regions that basically still operate with a socialist system. So there's residual structures that are available. Everyone, the hospitals are available. There's a lot of hospitals. There's a lot of doctors and a lot of facilities to service the ordinary people. When I go in the market, this is what I found interesting for me. I go shopping about 2 to 3 times a week. So I've been now to the markets maybe 4 or 5 times since this started. There's no panic. It's very orderly. There's toilet paper everywhere. There's hand sanitizer in different varieties available. There's fruit on my maintenance medications. Here I spend less than 10 a month for the same medications.
And what would that be in the United States? What would that be in the United States?
About $200. It's 5% of the cost, and they're the same medications. The difference is that the medications are purchased by the government and distributed to the pharmacies, and there's very strict price controls on essential medications. So they recognize that this is a poor country, that people can't afford $200 for medications, and so they have resolved it in favor of ensuring access over ensuring profits to the pharmaceutical companies and the medical supply system. But that's true with many things in Moldova. And again, I would describe it as a mixed political economic system. We have a socialist president. We had a social democratic prime minister recently. They have actually successfully attacked a lot of the corruption that had dominated Moldova for a good part of the post-Soviet era. But it really is a matter of people that talk to each other. It's remarkable. But they talk to each other. There's a sense of unity about serious issues. So there's a vitality to the fabric, the social fabric of the country, and I think that's very important. If I was to offer any insight to anybody in the United States or wherever, England, the other countries where I have friends, it's ultimately people have to come together around solving these problems. Yes, there's a socialist government here that's actively pursuing policies for the people. That's what real socialist governments do. And yes, we have a private sector, a very vital private sector, and there's lots of businesses here, and so it's a kind of a mixed economy. But the fabric itself, what holds the country together, is that sense of community, that capacity to work with people. We have Russians. 30% of the population is Russian speaking. 40% is Romanian speaking. We have people from that speak other languages as well. It's a very multicultural country, surprisingly, for a small country. But all the people here understand that the only way you survive is by working together with each other. And so there's that sense, even with the differences, the religious differences, the political differences, the cultural differences, there still is an underlying sense that in order to get by, to survive, you have to come together and work with each other.
And again, we're talking with Darrell Whitman, a former federal OSHA whistleblower and lawyer, and has been fighting with other health and safety whistleblowers throughout the United States to protect health and safety. And you talk about communes in Moldova. Very few worker cooperatives in the United States. Workers really don't have a say. I've just interviewed some UPS workers. They're not even provided with sanitizer, with masks. Bus drivers in Chicago, CTA, are not provided with proper health and safety protections. In fact, the issue of protecting the essential workers in the United States, the transportation workers, the medical care workers, they don't even have masks, enough masks for healthcare workers. Do you think that this disorganization in the United States is precisely because of capitalist control of production?
Well, of course. I mean, that's what capitalism is. That's the free market, supposedly, but of course, we know that it's no longer a free market. It's a controlled market. Capitalism is about waste. That's what it does. You have all these different people supposedly competing for a place in the market and to sell their goods or their services, but in fact, you now have really what I describe as corporate fascism, because it's the major corporations are really running the government, and the government is no longer a democratic, it reflects the democratic will of the people. So the system is not designed to meet social needs. There's a certain lip service that's paid to that. I know that the Democratic Party has managed to attract the people to support it because it offers lip service rather than really. The issue that needs to be addressed is who's actually in power in the United States, who's actually making policy. The workers should be representing the workers politically, not just having showcased unions which they offer you benefits like my union does, like free discount tickets to Disneyland and that sort of thing. Well, that's not what a union is about. It's about working and representing its membership, but more importantly, good unions represent the public, either directly or indirectly, by maintaining quality standards of production and ensuring the health and safety of their members and the public in these systems. But that's pretty much gone. It just doesn't exist anymore. And it did once exist. At least it existed in a much broader sense, and we know that from the experience of the 1930s, late 30s, when the unions organized and they were powerful. People can refer back to the strike in San Francisco in the late 30s. The general strike. The workers were powerful at that point. So there's a lot of good examples of what good unions can do for their members, and a lot of good examples what that means for the community. I'm a native San Franciscan, and I grew up there, and I remember going away and then coming back in the 1980s and being shocked to see homelessness. We never had homelessness when I was growing up there, even though I was very, very poor, and we struggled. We had a place to live, and we had our communities. When my mother was sick, our neighbors would come and bring us dinner. We shared things when somebody got a bonus or a little extra money, and they knew that their neighbors were struggling for some reason. They shared it. There was that sense of community and solidarity. And if we're ever to get back to the point of having a meaningful society, we have to have the participation, real participation, meaningful roles for people to play in choosing what kind of a society we have.
So, okay, thanks for giving kind of an overview of what's happened in Moldova. And I think for people in the United States who are some of them are in a panic mode, are afraid of what's going on and afraid of being contaminated, afraid of a breakdown in society. What you're saying is that there is a way of organizing the country and for people themselves to really start to take control of the situation, so they're not reliant on somebody else to do it for them. I think a lot of people in the United States have been told that somebody else will do it for them. The elections, Bernie Sanders, somebody else is going to do it for them. But it sounds from what you're saying, the people themselves have to organize themselves if they're going to be able to help really defend themselves in this new world situation.
Yes, absolutely. That is the bottom line. That is the big lesson of all of this, and is also the lesson of history. This was until this last year, the poorest country in Europe, officially per capita income. tragically, and for very bad reasons, it lost its leadership as the poorest country to Ukraine, which is now the poorest country in Europe. But at the end of the day, without having oil and gas and financial empires and all that, this little country may, at the end of this process, in 2, 3, 4 years, may actually take a leading role in this part of the world, because it's actually, to a certain extent, it's a matter of size. I remember an interview that was done with some farmers. This is an agricultural country, and if you went outside the city of Chisinau, you would quickly go back in time, probably 50, 60, 70 years, when people lived in very small villages and towns, and they were agricultural workers. That's why there's still communes here, because a good part of the agriculture is still organized in Marxist terms, by the peasants who own the land now, instead of being, landless peasants. And there's a whole, up in Orehi, which is a rayon, a county, about 50 miles north of the capital here, Chisinau. The head of the rayon, the county government, is a communist. And it is a mini communist state inside of Moldova, and it's beautiful. It's a beautiful town. They have a big celebration once a year. People, go up there for the celebration. But it's a demonstration project on what, if it's run without the corruption of that unfortunately entered into the bureaucracy. The Soviet bureaucracy became very corrupt. If you can cure that, you can have a very livable, environment, a rich cultural life, because Orehi is famous for that now. They promote arts and dance and music and crafts and things like that, and it's a beautiful little town. So it kind of shows you that, given the opportunity to, and I think it is a function of size, for people to participate meaningfully in the conduct of the life of their community, and you can only really do that, in a socialist system. That's the reality. That's historic reality. Capitalism reduces waste, and mostly it wastes people. So it shows you what can happen. What is good about it. There's a lot of problems here that still remain unresolved, but at the end of the day, the people here work together well.
And I think that's what people in the United States are going to have to do.
That's exactly what you have to do.
In surviving. In surviving this economic, social, and this healthcare catastrophe that people are facing in this country now.
Yes, absolutely. The working together is the essential part. And, of course, implicitly, that is a socialized system.
Okay. Good.
So thanks for the update on what's going on there. And I'll keep you posted on what goes on here. We're still, inching forward, and actually it should be a very interesting time immediately ahead. I'm getting some stuff back now, so hopefully we'll do our deed before everything completely falls apart.
Good. Well, actually, your report could be very important for people in this country to focus.
Yes, and again, one of the things that struck me in contrasting Moldova with the U.S. and Italy and the other countries, there is no sense of panic here. None.
That's striking.
There's a certain amount of anxiety, but there's no panic. Yeah. People have basically immediately turned to asking, what can we do to make this process work to protect people.
We've been talking again with Darrell Whitman, former OSHA inspector and lawyer and whistleblower who fought against Tom Perez, who was Secretary of the Department of Labor, who was involved in covering up his firing, along with many other workers who were fighting to protect the health and safety of working people in the United States. So thanks for joining us on WorkWeek.